Good morning and welcome. I'm Pamela Walker, Health Promotion Consultant with the Washington Wellness Program in the Office of Employee and Retirees Benefits at the Washington State Healthcare Authority. I will be facilitating today's session as well as co-presenting. We also have Kat Cook, Benefit Strategy Analyst. She's also from the Office of Employee and Retiree Benefits, and she will be co-facilitating. So I'd like to begin by just briefly going over some housekeeping items. We ask that you keep your microphones on mute during the session, and we will open it up for questions and comments throughout the training, so please submit those in the chat box. And then please expect and look for 2 follow-up emails after today's session. The first one will be tomorrow from GoToWebinar. That email will provide a short evaluation question, and we ask that you complete and submit that as we welcome your input and feedback. And then the second follow-up email will come from the Washington Wellness team members, and that will provide a link to the recorded session for today's training, as well as the PowerPoint presentation slides and all related resources that we tapped into to bring this training to you today. Okay. All right. I want to begin by emphasizing that there are over 43 million Americans living with a mental health condition every year, but most of them are not getting the treatment that they need. And one of the reasons is stigma, the negative stereotypes and misconceptions about mental health that persist in and out of the workplace. And despite the prevalence, we often have a hard time understanding mental health conditions. There are so many misconceptions about what mental health is and what it means to live with a mental health condition. For example, mental health conditions are not caused by personal weakness or lack of character or poor upbringing. They are caused by medical conditions that impact a person's thinking, feeling, or mood, and may affect his or her ability to relate to others and function on a daily basis. Genetics, the structure of the brain, the environment, and lifestyle all impact mental health. And when people living with mental health conditions are defined or labeled by their illness, they become a part of a stereotyped group that experiences shame, blame, and secrecy. In fact, as the slide shows, stigma is one of the main reasons why people delay treatment for 8 to 10 years on average, and many still never get any help at all. And of course, now with the COVID-19 pandemic, our nation is experiencing a surge in people showing signs of depression, anxiety, and other mental health distress. Recent data from the U.S. Census Bureau shows nearly a tripling of people experiencing signs of depression and anxiety. So with all of this stress, uncertainty, and changes facing everyone at this time, it's important now more than ever to address mental health stigma in the workplace so employees can feel supported and seek out the treatment and help that they need. A little bit of a delay in changing slides. Bear with us. Okay, there it is. So, what we very much want to accomplish today is we hope to broaden your knowledge and understanding of the impact of mental health and stigma in the workplace and provide you resources and tools that you can use to reduce stigma and foster a mentally healthy workplace. Specific objectives, we want to increase your understanding of the impact of mental health. We'll be sharing data and information to do that. We will be providing guidelines and resources, turnkey ready and customizable toolkits to help you move towards a stigma-free culture, and also highlight and review mental health benefits, support services, resources, and resources available to employees and their families. Okay, so to help us do that, we have a panel of guest speakers. First, Rebecca Parrish. She's an integrated mental health clinical consultant and social work manager from Kaiser Permanente, Washington. There's Carrie Ullman, employee assistance program counselor and licensed mental health counselor from the Washington State EAP. Then there's Kevin Klein, senior workforce health consultant from Kaiser Permanente, Washington. So now I'm going to hand it over to Rebecca Parrish, and she's going to begin with the first objective this morning, understanding the impact.
Thank you so much, Pam. This is Rebecca. Can you hear me?
Yes.
Beautiful. Thank you for confirming that. I want to start off, let me make sure I can move the slides here. Awesome. I want to start off by just thanking all of you for being here today. I think that your participation in this meeting shows your commitment to really doing all that you can to help create a stigma-free workplace and support the people that you work with in identifying and addressing mental health needs. I will have the floor for about 25 minutes today, and my goal is to keep my comments to about 20 minutes so that we have an opportunity to talk a little bit and have some question and answer time at the end. As Pam talked about, in order to truly support workforce health, it's essential to provide access to mental health services. So we're glad you're here to learn about how to support your teams. As we're getting started, I actually want to introduce the group here to an idea called a dialectic. A dialectic is an important concept in a type of mental health treatment called DBT, or dialectical behavioral therapy. And the idea of a dialectic is that two opposite truths can both be real at the same time. And I bring this up because I see us facing a dialectic in what we're discussing today. Mental health needs are surging, creating significant challenges, and these challenges stand to help us fundamentally shift the way we think about how we are supporting mental health and wellness. And so my goal today is to highlight both the challenges and the bright spots and opportunities coming from those. And so I want to start with just a little bit about the landscape of mental health needs and resources prior to the COVID-19 pandemic. So estimates range that between 1 in 4 and 1 in 5 adults has a mental health condition. And as Pam mentioned, that's over 43 million Americans that are living with a mental health condition every year. We were seeing a significant increase in demand for mental health services even prior to COVID-19. And there are, as you can see listed on the slide here, a number of factors that were driving that demand, not the least of which were a couple of really good things. There was an increase in mental health awareness, and so much work has been done around decreases in stigma. And I think both of those are a good thing. And the reality is it increases demand. So we lay that increased demand on top of a national shortage of clinical workforce. And what that creates for us is challenges around access to care. So come February and COVID-19 hits and throws all of us for such a significant loop. I hope all of you had an opportunity to review the April 2020 Washington State Department of Health statewide high-level analysis of forecasted behavioral health impacts. This visual is actually from that report because it, I think, did just a fabulous job of helping to frame what we might anticipate around how the COVID-19 pandemic would impact mental health needs. So you all know when COVID hit, we started to experience the side effects of the pandemic as a society: job losses, financial strain, illness, isolation, all of which were predicted to cause a surge of mental health needs. So what you can see here is that we have really been framing this in terms of different phases of needs, with the first 2 to 3 months characterized by significant increases in anxiety. This is so understandable to me. Fear and anxiety about a new disease and what could happen, job insecurity, food insecurity, all of these things can be overwhelming and cause strong emotional reactions in both children and adults. We see depression starting to increase after that, with an anticipated peak as we head into the holidays in November and December. And I just want to point out again that public health actions that are necessary to mitigate the spread of COVID-19, things like social distancing and work from home, are needed and can make people feel very isolated and lonely, increasing stress and anxiety as well. And then the other key thing that I would call out from this forecast was that there was identified an increased risk for suicide, which is anticipated to peak around September. And so I know we talked about, the 43 million Americans in a given year who were accessing mental health services. And I think it's helpful for this group to know that prior to COVID-19, we anticipate that approximately 650,000 Washingtonians were receiving mental health services. Based on that information, based on what we know about the Washington state population and what is known around sort of common psychological responses to disasters or pandemics like COVID-19, what we anticipate is that up to 2 million Washingtonians could experience behavioral health symptoms, things like acute stress, anxiety, or depression this year. And that these symptoms may be strong enough to cause distress or impairment for most people in the group. And the data is supporting what we had anticipated early on in the pandemic. Pam talked about the US Census Bureau, which showed nearly a tripling of people experiencing signs of depression and anxiety. And the Kaiser Family Foundation, as another example, reported that 45% of US adults report that their mental health has been negatively impacted by the COVID-19 virus. And so, right, this is a challenge, right? We were already challenged around access, enter COVID, and demand is increasing even more. And so I want to share some good news, which is that the typical response to disaster is not disorder, but is resilience. And there are things that we can do to help support resilience. Things like helping people to make connections, big and small, supporting people in developing and maintaining a sense of purpose through the COVID-19 pandemic, supporting psychological flexibility, and helping people to focus on hope. Hopefully my slide will go here. There we go. And so I would guess that many of you are familiar with a lot of the things that help to drive our health outcomes. One of the things that I think has been a surprise for some of the people in our health system was that 40% of health outcomes are determined not by what happens in the medical office with you and your provider, but instead are dependent on social drivers of health. These are things like housing stability and instability, food insecurity, poverty, social isolation, and poor access to healthcare. And all of these things, as we've discussed, have been made even more challenging for people by the pandemic. And so some additional good news that I see coming out of the COVID crisis is that healthcare organizations and communities in general are increasingly attentive to these social drivers of health. And I will speak to one of the things that we've done here in KP Washington, which is we have actually been doing outreach to our members. And in that outreach, we're doing targeted screening for social needs, asking if they need assistance with food, housing, medicine or medical supplies, employment, transportation, or loneliness. And we are driving here in KP Washington towards building out an annual social health screening and assessment process that will mirror the annual mental health screening process that we have in place now. Because again, the recognition of how social drivers of health impact both mental and physical health is growing every day. In addition to those social drivers of health, no conversation around mental health needs would be complete without speaking about how ACEs, or adverse childhood experiences, these are traumatic events that one experiences in their childhood, impact people's mental and physical health. You may know that many studies have now shown that there is a significant relationship between the number of ACEs, such as divorce, mental illness of a close family member, incarceration, homelessness, intimate partner violence, emotional or sexual abuse. Um, excuse me, there's a significant relationship between those ACEs and a variety of negative adult incomes, including physical and mental health and substance use disorders. And the more you've experienced, the more likely you are to have those negative outcomes. And again, the dialectic, because the good news here is that awareness of how ACEs impact people's physical and mental health over time is pushing society to build out supports to protect kids from these traumatic events. And with increased knowledge about ACEs, more and more individuals and organizations are looking at how they can use trauma-informed care to provide support and mitigate the negative outcomes that would otherwise come from these experiences. I wanted to talk a little bit about the community response to mental health needs and to the COVID-19 epidemic, because I think this speaks so much to the way that we as a society are showing resilience rather than disorder in our response. And so what I included here was just a few of the shining star examples of the ways that folks in organizations and as individuals have responded to the growing mental health need. So first, shout out to the Washington Listens line. I hope you are all well familiar with Washington Listens. This is a telephone line that has been launched in the last couple of months with a goal of supporting individuals to manage stress and cope with the changes due to COVID-19. On a national level, I wanted to call out the examples of the SAMHSA disaster distress line. Similarly, a telephonic support line to help people experiencing emotional distress related to the COVID-19 pandemic. And then also give a shout out to the Veterans Administration for their COVID Coach app. This is an app designed to support self-care and overall mental health during the COVID-19 pandemic. And I actually chose these two as our national examples really intentionally because I loved that between the two of these, we're really looking at how do we provide types of support in different modalities, because not everyone is going to want to call in and talk with someone on a telephone line. Other people might be more comfortable downloading an app and getting the support that they need that way. I also wanted to give a shout out to the response from groups, our sort of peer support groups in the community. NAMI, or the National Alliance on Mental Illness, Alcoholics Anonymous, and Narcotics Anonymous pivoted incredibly quickly with COVID-19 and have switched from a face-to-face in-person group platform to virtual platforms to continue to provide peer-to-peer support. And then as we think about sort of the hyperlocal response, we see things like communities coming together and putting out giving tables where individuals who have an excess of something have an opportunity to share them with others in their community who might be struggling with food insecurity. GoFundMes, and then other community donations to provide financial and food supports. I know in my community, the local PTA has been helping to support families struggling to be able to pay their rent because of job losses related to the pandemic. And I feel like this helps to create those connections, develop a sense of purpose for people, supports that psychological flexibility, and helps people focus on hope. Let's see. Sorry, I've got a little delay on the slide there. So to refocus on workforce health, some data that you may be familiar with. 3 in 4 employees have struggled with issues or concerns that impact their mental health. And you likely also know that depression is positively correlated with many other chronic health conditions, including heart disease, diabetes, stroke, and Alzheimer's. When we think about our employees, I think it's also really important to recognize that many people are teleworking for the first time in their careers. They're isolated from their coworkers, their daily routines have been disrupted. And so it's natural that these disruptions would cause additional anxiety, stress, and potentially physical, mental, or financial strain. So now, again, more than ever, we must take care of the mental health and wellness of the people and the teams that we support. And so again, the good news, mental health concerns are treatable. And so we've got some data here on, for people who get treatment, how effective is it? So 8 in 10 people who get help for depression, treatment works for them, and up to 9 in 10 people who get help for panic attacks see a great response as well. There's a significant business impact for organizations when they think about how allowing untreated mental health concerns in their workforce impacts the organization. And so some statistics here as well. Up to 62% of missed work days can be attributed to mental health conditions. Untreated depression costs close to $10,000 per employee per year in absenteeism and lost productivity. And worldwide, mental health concerns are the single greatest cause of worker disability. So a very significant impact. I want to talk a little bit about the mental health and wellness continuum. I think something that you are all well aware of is that mental health and wellness is not black and white. You experience this in the work that you do with your employees. Some of them may have serious mental health conditions that require long-term treatment, while others are doing well, but would still benefit from wellness support, tools, and resources, and others might benefit from short-term interventions designed to support their needs. Within Kaiser Permanente, we think about mental health and wellness as the wide array of services and resources provided to our members in support of prevention, treatment of mental and behavioral health conditions like depression, anxiety, psychiatric illness, addiction and recovery, developmental disorders, and emotional well-being. And so I want to take just a moment to talk about the different areas on the continuum here, starting with emotional well-being and resilience. So the work that you do, I feel, is really key in this area. Things like workforce wellness programs, employee health programs, stress management support, fostering opportunities for connection, and opportunities to connect with apps that promote wellness, such as My Strength or Calm, can be great supports to put in place for folks who are doing well and who are interested in building their emotional resilience. I would additionally put population-based screening for mental health and substance use needs in this area, because again, what the intent behind that is really the idea of normalizing mental health as something that must be maintained, just like your physical health. We want to reduce stigma and make primary care a safe place for individuals to come for their mental health concerns. For individuals with mild distress, they might require a little bit of a heavier touch. And so some of those things addressed in emotional well-being and resilience would benefit this group as well. But in addition to that, brief interventions by their EAP, by the workforce wellness team, or their medical team, such as their primary care provider or an integrated social worker, could help them to get refocused and come up with a plan around what they might do to address their distress. Stress management programs, those apps like My Strength and Calm. And then there are a lot of new tools out there. One example that we've recently implemented here at Kaiser is behavioral health coaching. And so this is actually an opportunity for folks to get 24/7, 365 real-time text-based support from a mental health and wellness provider. So it's a great opportunity in real time to practice skills, get ideas, et cetera, and can be a great support for someone in mild distress. For individuals with a clinical mental health condition, we really want to engage them in ongoing management of that concern. We want to do continued assessment of symptoms and engage in what we would call within the healthcare world a treat to target approach. So the idea is we will continue to assess symptoms with a goal of reducing those, adjusting treatment as necessary if we're not seeing improvement. This is another group where we can think about how we might expand what is offered to those other groups. Things like group offerings to help reduce the stigma and feelings of isolation that come with mental health conditions can be beneficial. And so both within the healthcare system and then in those community groups is important to do. And then for those with severe mental health conditions, these are the folks where really specialty mental health services can be most beneficial. So this is things like psychiatry and therapy, neuropsych testing, and case management services. And I do want to highlight that most individuals with an acute mental health need can still be supported in a time-limited way, but there are a subset of individuals with severe persistent mental illness that will need long-term support. And so to talk just briefly about our approach here at Kaiser Permanente, we work to really help individuals maximize their total health, mind, body, and spirit. And in order to do that, we really have a number of principles that help to guide this. As mentioned, we are outcome oriented. We are focused on clinical outcomes and objective quality, and we measure and monitor that those outcomes to make sure that individuals are getting better. We have a collaborative, team-based approach. We also have a system-wide no wrong door policy. We encourage members wherever they're connecting with our system to request help for their mental health services. Additionally, we look to create multiple ways for people to get support, whether they're interested in connecting face-to-face, by phone, by video, or in person, through an app or online. And then our mental health services are both proactive and personalized. Mental health screenings are embedded in multiple care areas within our system and are tailored to members' individual needs and goals. Oops. Lastly, again, I think our goal is always to keep our members in the center. So while we have clinical guidelines and evidence-based best practices, these are balanced with patient preferences and patient goals. Treatment is different for everyone because every person is different. And the type of treatment your employees get, the frequency of their visit is tailored to meet their individual needs. And so in summary, when it comes to mental health needs, we're in a challenging situation right now. Demand is increasing, and this provides us with some amazing opportunities to rethink how we provide support to our population. We must move forward from a model that would have us pair each individual with a mental health need with an individual provider for one-on-one care, and look to move to a model that looks at how we will meet the needs of the population across the mental health and wellness continuum. And each of you plays a vital role in that transition. The work that you do to support workforce wellness and educate people about the resources available to support them across the continuum is pivotal to help us meet the evolving needs of our community. And for your work, I offer my thanks. And I think we've got just a couple of minutes here if anyone has any questions. And I don't know if there are any questions in the chat, Kat.
There are. We have 2 questions in the chat.
Great.
The first question is, where do we find the apps mentioned, My Strengths and Calm?
Oh, lovely question. Thank you. So for individuals who are Kaiser Permanente members, if they go to the Kaiser Permanente Washington website, go to Get Care, and then to our mental health and wellness webpage, there's a link on that page to get signed up for My Strength. And it is important that people go through that process. And so Pam, maybe what I can do is draft up a little bit of information that you could share with the teams when you send out the email, just giving a little bit of a step-by-step instruction for folks. And then, awesome, I'm happy to do that. And then the Calm app, which is a meditation-based app, is scheduled to be made available to our Kaiser Permanente Washington members in the Q4 2020. So as soon as that is available, we can get in touch with Pam and let her know the steps to access that as well.
Okay, Rebecca, we got another great question for you. The question is, what is the difference between psychiatry and psychology? When would you see one versus the other?
Oh my gosh, what a lovely, lovely question. Thank you for that. So a psychiatrist is a medical doctor, and a psychologist is a trained mental health provider with a doctorate in psychology. Within our system, psychiatrists' work typically focuses on the prescribing of medications to help treat mental health conditions. And so typically our psychiatrists are reserved for support around medication management and helping to finalize a diagnosis if other members of the care team are struggling with that. Psychologists within our system are actually used as essentially diagnosticians. And so as we are looking to make specific diagnoses, they have specific testing work that they do. It's called neuropsychological testing, where they would run through a battery of standardized tests to help us finalize a diagnosis. But psychologists can also work as therapists or as integrated mental health consultants. So they can be used in sort of varying roles.
Okay, so we've got another one here that's very COVID specific.
Yeah.
So do you have recommendations about how to engage community members in peer-to-peer support groups who do not have access to laptops or Zoom?
Oh, that's such a great call out. And I think, again, another silver lining of the COVID pandemic is that people are becoming more and more aware of how access to technology or lack of access to technology has such a significant impact on the ways that members can receive support. And so again, I think for people who don't have internet access and aren't able to access apps, relying on things like the SAMHSA disaster distress line, Washington Listens, is probably the best way to go. I can share that additionally here at KP Washington, we have developed a virtual COVID group. It's an hour-long group. It meets twice a week, and we're sort of teaching skills around managing anxiety related to COVID, and people can call into that as well. Ideally, we would have them join online, but we're also really concerned about making sure that the support that we are building internally is available to folks, even if they don't have that internet access or computer access.
Okay, we also had another person comment in the question facility that said calm.com is also available in the App Store to anyone who wishes to download it, so you don't have to get it through KP.
Yeah, there may be a fee associated with that. I am not quite sure, but again, you know, My Strength is not available in the same way. You do have to have, you know, either a token from a healthcare provider or again, sign up via our website in order to get that.
Okay,
yeah.
Great. And we have another question that from a wellness coordinator who's in an area not served by Kaiser, and she wondered if you had any recommendations for other apps that they could recommend.
Yeah, so again, I think, right, Calm is available for folks. Oh gosh, there's also, I think it's called virusanxiety.com. That would be a good resource for folks. The VA COVID Coach app would be good. I think those are the main ones that our integrated social workers are recommending to our members.
All right, fantastic. Thank you very much.
Yeah, thank you everyone so much.
I also wanted, this is Kat, I also want to address a question I've seen a lot in the chat. You will get a copy of this PowerPoint after this presentation, so you're covered, guys.
All right, well, thank you everyone for the questions. And at this point, I'm going to hand it back over to Pam, who is going to talk with us some more about moving towards a stigma-free workplace.
Thank you so much, Rebecca. So now we will be turning our attention to the second objective for today's session, and that's providing guidelines and resources to help you move towards a stigma-free workplace. I want to begin by emphasizing that fighting stigma starts with each of us, all of us, and it's about committing to creating awareness, encouraging acceptance, and challenging false beliefs about stigma. And by addressing stigma in the workplace, employers have a unique opportunity to make it easier for their employees to get the help they need if they're suffering or struggling with mental distress. In fact, in a workplace culture where mental health is not stigmatized, employees are more likely to be aware of available resources, start treatment sooner, and recover more quickly. So I wanted to share with you some identified benefits of being a stigma-free culture. First of all, it fosters employee loyalty and retention and also helps decrease absenteeism. And plus, when employees start to feel better about their mental health, they also feel better about their jobs and are much more engaged and productive. And then it plays an impactful role in decreasing the impact and cost of disability because, in fact, mental health conditions are currently the leading cause of disability in the United States at this time. So now, how can organizations move towards developing the stigma-free workplace? What's presented on the screen are 3 overarching best practice guidelines that are found to be very impactful in creating a stigma-free workplace culture. One is recognizing that stigma is real. Secondly, promoting mental health benefits and resources, and increasing awareness and providing education. So let's take a little closer look at each one of those. Well, a simple but significant thing that workplaces can do is to pledge to be stigma-free. It can truly make a difference by pledging to foster a workplace that promotes, supports, and improves the mental health of employees and their families. Again, can make a significant impact. It shows that you recognize that stigma does exist, and that it reflects your organization's commitment to the emotional well-being of employees. This is an example pledge that I've taken from NAMI. I will be sharing in just a few minutes some great resources that NAMI has to offer to support workplaces addressing mental health and stigma. So now, promoting mental health benefits and resources. Actually, it's been pretty clearly determined that another barrier that delays treatment is employees not knowing what mental health benefits are available to them and their family members, and not knowing how to access those benefits as well as resources. Because when employees are in distress or struggling with a mental health condition, knowing what mental health benefits are available and how to access those, it greatly increases their understanding of moving forward, what they need to do to take a step towards receiving the support and help that they need. And employers have a key role in ensuring that employees are understanding what their benefits are and how to access those. Some examples, some beginning examples and ways that you can increase awareness and educate employees about benefits and resources as well as how to access those. One example is that you could, during new hire orientation, provide a segment that focuses primarily in this area. Also, I know many of the wellness coordinators have brought employee resource groups to their organizations. You could address the mental health benefits, resources, and access during one of those sessions. Also, by taking a close look and reviewing all the possible internal communication opportunities to increase awareness and education for the employee benefits and access. And then lastly, the last example I have is looking what's out in the community for mental health activities. Oh, I'm sorry, I got off track, I apologize. So anyway, what I wanted to say is look for existing opportunities in your communication channels, as well as newsletters, for example, other committees where you could provide information as far as understanding mental health benefits and resources. Okay. I jumped ahead to this one a little too prematurely, sorry about that. But now we are on increasing awareness and education, a very important factor, and moving towards a stigma-free culture. So I'll go over each one of these examples and how you can accomplish this. Providing employees mental health engagement activities can be really helpful and moving in that direction. Some examples include providing lunch and learns, bringing guest speakers on site to address this, implementing mental health awareness and education campaigns. For example, every May is Mental Health Month. And for example, NAMI offers a mental health toolkit, a campaign toolkit for workplaces to implement to increase awareness and education. And also looking at the community and what mental health activities and events are taking place in the community and promoting those to your employees can provide them additional opportunities. Another area, by offering employees opportunities to come together through social activities at work, or now through telehealth possibilities and options to come together and promote and build relationships with one another, really helps increase understanding and acceptance. And then a very important focus in addressing stigma is how critical it is to always use respectful, supportive language and communication when talking about and addressing mental health. And one way that can be done is to avoid labels. Labels that perhaps some of us have heard people make about mental health, such as, oh, he or she is challenged, or crazy, or demented, etc. So providing training, awareness, and education to help people become aware of that disrespectful language, to be very cognizant of it, and do their best to communicate in a respectful, supportive manner. And then lastly, providing training and education opportunities so that employees can understand and recognize the signs of distress and what they can do to support team members when they're struggling. And now I'd like to turn to actually two very valuable resources that provide toolkits and many, many other materials and collateral, so to speak, to implement actual campaigns in your workplace to address stigma. In fact, all the guidelines that I've gone over, they provide support materials and other resources that will play a key role in meeting those guidelines. So the first one is the Stigma Free campaign from the National Alliance of Mental Illness, also NAMI. And NAMI has created the Stigma Free campaign. It's a partnership initiative to challenge, highlight, and cultivate company cultures of caring, enhanced engagement around mental health. So NAMI can assist you in creating a culture that values employees' emotional well-being by offering, again, the toolkit. Actually, it offers several toolkits. I mentioned earlier that it provides each May a toolkit for Mental Health Month to promote and increase awareness and provide education. And also numerous resources, again, to support the Stigma Free campaign. So here's a list of some of the resources that they provide. They provide numerous fact sheets. An example, one's called Working Well, How to Promote a Supportive Culture in the Workplace. Numerous mental health guides. One called Creating a Stigma-Free Workplace, and they also offer guides for leaders to focus on this area and promote mental health and well-being in their organizations. There's many what they call messaging templates, and those are actually toolkits. I again mentioned the mental health one in May, and of course the Stigma Free company campaign is also one. Related to the time of year to promote mental health, not only is there a mental health month, there's also a mental health week, as well as a mental health day. And as I understand it, those are both highlighted and promoted in the month of October. Okay. NAMI also offers shareables, and what that means, they offer numerous workplace posters that you can utilize. And I'd like to stress that all of these resources, everything that they offer, are involved no cost whatsoever. And then many numerous infographics. And they do offer COVID-related resources and materials. For example, they offer a fact sheet and handouts on mental health conditions during the COVID-19 outbreak. They offer some telework support materials, one titled Working from Home, Managing Your Mental Health. They also offer great resources for supervisors and managers on how they can support their employees during this time, particularly that so many are teleworking. And then they offer videos. They offer actually 2 videos, and I have one presented here on the screen. And we were very much hoping to show this to you. It's only 1 minute. We've provided the YouTube link where you could do that, of course. And when you reference the NAMI materials at the NAMI site, you can also link to it that way. This is a 1 minute introductory for the Stigma Free Company campaign. It gives an overview of mental health and taking steps to become stigma free. NAMI also offers a 30-minute activity video, as well as planning materials to facilitate bringing employees together in a group, whether it's a lunch and learn or an actual designated training session for this, or even during a team meeting. It's an excellent video that stops and allows group discussion and calling out and sharing, and it offers an actual planning materials for the facilitator to facilitate this activity. So that would be something you might want to check into as well. Okay, I'm going to move ahead to the next toolkit and resources that we have identified to be very helpful. And this one is titled the ICU Program. And it was an awareness campaign developed for the workplace. It's designed to decrease stigma associated with mental health and foster a workplace culture that supports emotional health. A little bit of background about the ICU Program campaign. It was developed by the company DuPont through their Employee Assistance Program, and that was in 2011. And it since has been delivered to their 70,000 employees worldwide. And since then, DuPont has donated ICU to the Center for Workplace Mental Health, who now makes it available to all employers, meaning across all sectors, industry, and sizes for no cost. And actually, NAMI honored DuPont in 2012 with the Seeds of Hope Award for its commitment in advancing mental health issues. So they've been recognized by NAMI. It's an award-winning campaign. So let's take a little bit closer look at it. Okay. The ICU, their materials, and various other collateral resources focus on teaching and understanding employees that they're able to identify the signs of when work peers are in distress and could use support and possible help, how to comfortably and connect with that person, and then from there help them move forward to the next step to understand how they can go forward and seek the additional help and support they need if possible, if needed, excuse me. This lists the ICU toolkit materials. Again, they have videos also, and we're hoping to show you one of those in just a moment here. But they also offer an implementation guide, and the guide provides an overview of the ICU program and how it should be implemented in the workplace. It offers suggestions all through the planning, implementation, and even measurement, and how to utilize other ICU available components. It also offers a ready and customizable PowerPoint deck for leadership. It can be customized to fit your unique messaging from your organization. And what it does, it provides a high-level review of the ICU program. It states the business case for addressing mental health in the workplace and provides sample strategies for rolling out the program in your company. They also offer the ICU flyer that can be distributed along with the video or in follow-up communications with employees. It reinforces the video's key messages and lists resources for additional support. They have a customizable version of this flyer that's available that is easily modified to promote your mental health benefits and resources. And then there's an email and intranet template, and this is an actual email template that provides sample language that you can use whenever you share the ICU video by mail or by intranet. And then it offers the logo, and you can use that logo on any materials that you developed for this campaign. And then lastly, it offers a pre and post evaluation. And this is a very simple way, ready to go way to evaluate the effects of the ICU program if you implement it in your organization. So I am hoping that we can view, this is 4 minutes and 40 seconds, and this is the ICU video. So I hope you enjoyed that preview of the ICU video for the campaign that they offer. And now I will open it up to questions. If anyone has any questions about the toolkit and resources, the guidelines, anything at all I can address for you at this time.
Okay, Pam, it looks like the only questions we have were some technical problems with the video's audio. So it's okay.
Oh, I'm sorry about that. Okay.
Yeah, but for those of you who couldn't hear the audio, you'll get the link with the PowerPoint after the presentation, so you can view it at your leisure.
Yes, absolutely. We'll be sending all links and resources out in our email. Okay, then. Well, then we're going to, I can move forward here.
Oh, Pam, wait, I got a question here. Will this ever become mandatory training for supervisors?
Oh, excellent question and suggestion, I might add. I don't know. That's something that we could certainly explore, and how that process and, takes place for, what's considered to be mandatory for managers and supervisors to take. I think it's worth exploring. We'll see what we can find out about that.
Okay, we've got another question here. Is ICU available through NAMI?
No, it's available through the workplace center. I'm getting tangled up. I said it earlier. Bear with me. The workplace center, the Center for Workplace. I'm not remembering exactly, but no, it is not, and we do have that in our resources. I apologize. I'm just drawing a little bit of blank on the specific place where it's offered.
Okay, we got another question here. Oh,
go ahead.
So, Pam? They're asking if you have any guidance on approaching a coworker without being invasive.
That's a very good question. I know that this program addresses that, and I don't actually have specific guidelines or on how to approach someone that's not invasive. What I could say to that at this time is something along the lines of you don't seem to be yourself, or is everything okay? Is there anything I can do to help you? Or, when you recognize when someone might be struggling or in distress, just, try and ease into it and just say, are things going okay for you? You seem to be a bit different lately, kind of acknowledge and in a respectful manner that you've noticed a change in them, and offer your support and help.
Okay, Pam, that's all the questions we have for you at this time.
Okay. And I believe that where the ICU program can be referenced is the Center for Workplace, And so we do have that in our resources and a link. So you can reference the ICU program that way.
And Pam, we just had someone enter into the chat and say ICU is on workplacementalhealth.org.
Okay, thank you. I stand corrected. Thank you so much. Thank you. Okay. And we are going to take a break now. I can't seem to move my slides forward. Anyway, at this time, let's go ahead and take 5 minutes for a stretch break. And so by my clock, that will be 11:10. So we will meet you back virtually at that time. Okay, let's begin again. Kat, I'm not able to advance the slide.
That is because I already gave control to Carrie.
Oh, okay, all right. That's fine then. I do have an introductory slide to this. It's a new section, so it's.
Oh, sure thing.
Carrie,
I'll advance it for you then, and give you control back. Sorry about that.
Okay, slide. Thank you. Okay. All right. Well, welcome back, everyone. So our third and last objective for today, promoting mental health benefit services and support. We very much want to provide an overview and a review overall of what available mental health benefits there are, as well as services and support for employees and their family members. And so to start it off, I want to introduce Carrie Ullman from Washington State EAP, Employee Assistance Program. She'll be giving us an overview of all of what they have to offer.
Great, thank you, Pam. Thank you so much. So good morning, everyone. I'm Carrie Ullman, as Pam has said. I'm a Washington State Employee Assistance Program EAP counselor. And I'm really glad to be here today, and I really appreciate the opportunity to talk about mental health in the workplace. Also, I just want to thank you for the important work that you're doing to continue to promote wellness, because this is so helpful and needed, particularly in these challenging times that so many are experiencing. So thank you so much for the work that you have done and continue to do. What I'm going to do today is talk about EAP and the services that we provide. And then I'm going to talk about resources that you could connect with through EAP, but also we'll talk about other mental health services locally and nationally. So I'll be talking for about 20 minutes, and then we'll have some time if you have any questions. So let me start off with talking about the services that we provide. So the Employee Assistance Program, you might be wondering, what is it? The Washington State Employee Assistance Program is a free, confidential counseling and referral services program that promotes health, safety, and well-being of public employees. We first began back in 1972 as a workplace alcohol intervention program. Over the years, though, our mission has broadened to support the well-being of public employees in all areas of their life. EAP promotes a resilient and productive workforce, and we help employees address both personal and work-related concerns by offering free and confidential services. So you might also be wondering, who does Washington EAP serve? And so let's talk a little bit about that. We serve all Washington State government agencies, but we also contract to serve other public service organizations, including higher education, public school districts, fire districts, public utilities, tribal governments, and many more. Our specialization for over 50 years has been in supporting public employees in Washington State. If you're not sure if we are your EAP, if you're in our EAP network, please feel free to check with your Human Resources Department, and they'll be able to let you know if you're in the Washington State EAP network or not. Many of you joining here today are, and there are some that are not part of our network. But I can still offer some ideas and resources that might be beneficial to you, whether you're in our network or not. So let me talk a little bit first about what concerns and a little bit more information about EAP, and then we'll talk more about specific resources. So what concerns can you bring to the EAP? Well, we support a wide range of areas, including assisting and supporting employees, faculty, and leaders in managing areas such as managing change and stress, financial concerns, relationship and family issues, grief, trauma, and mental health. And we really encourage employees to think of using EAP for maintaining their wellness. And so employees don't need to wait until they're in a crisis to give us a call. We have a broad range of services to meet a variety of needs, and there's really no concern too big or too small to seek help from EAP. So what I'd like to do next is tell you a little bit about the services that we provide. So you have just a brief overview. One of our key services that we provide are counseling services, or also known as EAP assessments. This is an opportunity for employees to meet with a professional counselor who will help them to identify their concerns, provide support, develop an action plan for any ongoing help needed, and get connected to the appropriate resources for the individual. These counseling sessions happen over the course of 1 up to 3 sessions per issue. And currently we're meeting with clients over the phone or over the web. Services are not only for the employees that are part of the network, the EAP, Washington State EAP network, but also for the employees' adult family members living in their household. So that would be adults living in their home that are 18 and over. We also provide support for children under 18 living in the household as well. The process for that is just a little bit different. So what we do is we meet with the adult caregiver without the child, and we discuss the situation, the impact that it's having on the family. We provide parenting support, help the parent create a plan, parenting plan, and we can also connect the caregiver to the appropriate child specialists for ongoing care or resources as needed. I think it could be really helpful to just identify how EAP is different from ongoing counseling or therapy. First of all, with EAP, we are free for those that are within our network. So there's no copay, no deductible, no bill that the employee has to worry about. And unlike counseling or therapy, where an employee goes through their health insurance, there isn't a need for an approved diagnosis. There isn't a need for a medical necessity to use the EAP services. EAP can be used for a variety of issues that wouldn't necessarily be covered under a mental health benefit through an insurance company, such as perhaps an employee is struggling with work issues, or maybe they're having relationship issues. So EAP provides quick and easy access. Clients are typically offered an appointment within 1 week of their intake. We also assist clients with finding an ongoing counselor by providing referrals for the employee, and if they're wanting them in their local area, or if they have a specific mental health specialty that they're seeking. EAP is designed to be short-term and solution-focused, so it's a really practical way of dealing with both work and personal issues. Also, as a workplace service, we help assess any impact that the client's concern is having on their job, and then help them to create a plan to manage any workplace issues that they might also be having. So that's a little bit about our counseling services. I talked about workplace issues. Let's talk about a support for that. So EAP provides consultation for supervisors, leaders, and HR professionals. So let me give you a few examples of when someone might seek this organizational consultation. A supervisor might need coaching on how to have a conversation with an employee who's struggling with their performance, or a human resources consultant might call EAP seeking resources for an employee who is suicidal or experiencing mental health issues or struggling with substance abuse. A manager might call us with help to seek help on figuring out how to best handle a conflict on their team. So there's a wide range of reasons that people might want to have an organizational consultation. These services are provided by skilled EAP staff counselors that have experience and knowledge in working with public service sector and higher education. So our EAP team has expertise on a variety of topics. Some examples of some of the topics are substance misuse, anger management, suicide, domestic violence, trauma, and organizational management. The consultations are provided over the phone or over the web, and we can offer same-day consultation for urgent matters, such as when there's a safety concern that needs to be managed immediately. Another service that we provide is crisis response. When a significant loss or traumatic event occurs, such as a traumatic death of a coworker, or maybe there's been an act of workplace violence, EAP can help guide managers or human resources on what to do in the aftermath and talk with them through what are the best practices for supporting the work group. If it's appropriate in the particular situation, we meet with the impacted team and facilitate a debrief or an educational group about grief or trauma. Our focus is really on providing education about how grief or loss are impacting the work group, and then ways to promote self-care and resiliency. Another benefit I would like to talk about is the work-life resources benefit. This is an additional benefit. So if you are unsure if your organization or agency has this additional benefit, and I'll explain a little bit more about it in just a moment, feel free to contact your human resources department if you're unsure if you have this benefit, or for this particular benefit, you do need a code to be able to access the information. And so you can also check with your human resources department if you have questions about that. So this resource is a wonderful resource that can provide thousands of articles with expert advice on a wide range of work and life topics, such as parenting, elder care, wellness, financial health, and workplace issues. There's also a database which can help employees find childcare, elder care, and even pet sitting, as well as many e-learnings and webinars. And one of my favorite things, some online legal templates, including a free will maker program that you can use. Through this benefit, there's also legal and financial consultation that employees can receive. For the legal benefit, it offers a free half-hour consultation by phone, and if there's needed ongoing services, that can be provided at a discount. This legal consultation can be used for personal concerns such as adoption, divorce, or neighborhood disputes, for example. The financial counseling, this offers free help over the phone with a financial expert. Examples of when an employee might want to use the financial consultation is if they're struggling to come up with their monthly budget, or they want to learn how to do that, or to get ideas on how to get out of debt or save money for a big life expense. So you can see the link on this webpage is eap.wa.gov/worklife is the link that will take you to this additional benefit. We have other resources that I'd like to point you to. If you go to our website at eap.wa.gov, in fact, right now, if you have the ability to do that in this moment on your computer and multitask, that would be great. I'll be referring to some different areas on the website, and you may want to click along with me. So just know you will get a copy of this PowerPoint after the presentation that will be emailed out to you by the team. And so everything, all the links that I've put on here, these are hyperlinks. Once you get the presentation, you can just click on the hyperlinks and it'll take you right to the website. But in the meantime, if you'd like to follow me by pulling that up on a screen, if you have that ability, feel free to do that. So on our website, you can sign up for 2 different newsletters. You can subscribe to them. The first one is the Employee Frontline, which covers a variety of interesting work and life topics. And then we have the Supervisor Frontline, which answers common questions EAPs receive from management. In order to subscribe for this, you just go to our website, eap.wa.gov. On the right-hand side, you'll see a button which says Subscribe to EAP News. You just click on that, enter your information, and the newsletter will come into your inbox monthly. Another really important web page that we have that I'd like to point you towards is our suicide prevention webpage. As Rebecca mentioned earlier in our time together, that the Washington State Department of Health has talked about how suicide rates and depression are expected to increase in the fall and winter of 2020. And so focusing on suicide prevention is really key with employees. So just know we have this resource available to everyone. So you can go to our webpage, eap.wa.gov/suicide prevention, all one word. This webpage offers links for those of you who are struggling with or employees that are struggling with suicidal thoughts. There's information on how to help a loved one or a coworker, general information on suicide prevention, information for managers and human resources, and also resources for those who have lost someone to suicide. So this is a really important web page that you may want to bookmark for yourself. Another important web page that we've recently added is our webpage on racism and mental health resources. And it can be found by going to our website, eap.wa.gov, and then clicking on racism and mental health resources, and it'll take you to the page. This webpage includes culturally specific mental health resources for Black, Indigenous, and people of color, and information and resources for those wanting to learn more about how to be anti-racist. There's information for state employees, and there's also information for leaders. Another web page that might be helpful is we offer on-demand and live webinars on a variety of work-life topics, including navigating change, self-care, how to build resilience when your job involves helping others in crisis, working from home, leading teams during COVID-19, and other topics. Information on these webinars can be found at eap.wa.gov and then clicking on COVID-19 resources. We'll also be adding more webinars, so you may want to bookmark this webpage as well. If your organization is not part of the Washington State EAP network, you might consider attending one of our live webinars or viewing one of our on-demand webinars as a way to get to know us a little bit more. This same COVID-19 resources page, if you keep scrolling down, you'll see a wealth of information on a variety of topics. Topics including resources for couples, taking care of others, domestic violence, parenting, grief and loss, mental wellness, substance use, working from home, information for veterans, just a wide variety of information. So that's a little bit about the services that EAP provides and our resources, but I want to also leave you with some additional resources just to consider that might be helpful for you or your employees. So when you receive this PowerPoint presentation through the email from Pam and the committee, you will have this page here, and you can just click on each of these are hyperlinked, and they'll go directly to the web page. Let me just point out a few here that might be helpful. I have Alcoholics Anonymous in here just as a reminder to let everyone know that Alcoholics Anonymous, which offers support excuse me, for those struggling with alcohol and or drug addiction and their family members, they have virtual support groups. And so it's important for people to know that those resources continue to be available. You can see I've added a link to the American Psychological Association, which has a wealth of information related to COVID-19, as well as other mental health information about mental health in the workplace, and a wide variety of other information. Below that, you can see there's a link for parenting tips. And many families are struggling right now in this area around how to balance work and family life, particularly as we move towards schools reopening. I have a link for the Center of Workplace Mental Health, which offers lots of free information, so feel free to check that out. I do have a link here to LinkedIn Learning, which might seem kind of surprising, but many public employees do have access to their learning modules. So I just want to let you know, we often don't think about this, but there's a wide range of topics for the workplace, such as stress management, building resilience, avoiding burnout, balancing work and home life, and there's mental health specific topics such as managing depression and anxiety. So consider that. And then the National Alliance on Mental Illness, they have some wonderful information, and Pam's already talked about that, and so I won't dive into that, but just notice I've put a COVID specific guide. That's a wonderful guide that you may want to consider. And then a few more resources. I provided the Alcoholics Anonymous link, so I also wanted to provide the Smart Recovery link, as it's an alternative to Alcoholics Anonymous for those who prefer a non-faith-based program or group. Another great group website is UC Berkeley. So you'll be able to click on that. It's a wonderful website with lots of information for workplace leaders, parents, and for employees. And then the report that Rebecca was identified earlier from the Washington State Department of Health, I've included a link here to that. I think it's just really informative, so consider checking that out, and I imagine they will be updating that as we move into the year because they've already updated it from their original report, and you can just Google to find an updated version, search that, but the link I have in there right now is to the most current version. Another support I want to let you know about is the Workplace Learning and Performance. It's a training division within the Department of Enterprise Services. They're offering a brand new one-day virtual class on mental health first aid. So this is a really important topic, mental health first aid. There is a cost for it. It's $125. It's available. It'll be online. It is available to Washington State agency employees, as well as employees of Washington State cities, towns, municipalities, public schools, higher education, and public sector nonprofit organizations. You'll see a link here. If you are from a state agency, you would just go through your learning management system to sign up for that. If you are from another entity, you would click on where I have it hyperlinked here, and that will give you the form to complete. I have information on the actual class hyperlinked where it says mental health first aid. So those are just a few resources that might be really helpful for you. And so I just want to let you know that we are here for you. We are free and confidential for those that are within our network. And we are really, would love to help serve you. And so you can contact us by calling 877-313-4455 or go to our website at eap.wat.gov. And feel free to reach out to us if you have questions or seek additional information. I'm not sure on the time if we have time for questions or not, but let me just check in with the group and see Kat and Pam.
Okay,
Yeah.
we do have, what was that, Pam?
No, please go ahead.
Okay, we do have a few questions. The first one is about EAP pricing. It says, can it be confirmed that adding the work-life resources costs an agency $1 per employee per year? I'm pitching it to our executive team.
That's a great question. I don't know that answer. As a counselor, I don't know that answer, but what you could do is call EAP at 877-313-4455 and let them know that you would like to get information about that, and we can easily and quickly get you that information. Yeah.
Okay, great. The next question is about the work-life site. Does the information on the work-life site, specifically the wills section, is this current for the state of Washington?
My understanding is it's a general will maker, and so it would be more for simple wills. What you could also do is then use the legal consultation, the free half hour. You could create your template, fill in your template, and then use that half hour to check in with a legal professional to make sure that you have the information that you need. So that's an idea of how to do that.
Okay, those are all.
Excuse me, this is Pam. In the interest of the last section of this training, we're running a bit behind. Perhaps.
That's cool. We're done with questions.
Oh, okay. Well, that was good timing. I thought there was more. All right, then we'll move ahead.
Great. Well, thank you, everyone. And what I'd like to do is turn it over to Kevin Klein from Kaiser.
Welcome, everyone. Thank you for joining us today. Appreciate that, Carrie. Thank you so much. I'm going to talk about Kaiser Permanente resources and start off with general access. This is for Kaiser Permanente, Washington. As you know, Kaiser Permanente Northwest has Clark and Cowlitz County among the Southwest counties in Washington as well. They are a different region, so when I talk about the resources, there are different phone numbers and different access and websites, so make sure you're aware of that. I'll delineate as much as possible, but just so you're aware of that, I'm sure most of you know that already. And if I could access the next page, let's see. Sorry about that, it's not moving forward.
Kevin, I can advance your slides for you if it's not working.
Yeah, it's not. Thank you. I'll just.
No problem.
Perfect. Thanks, Kat. As I said, access is a nationwide problem. It's not just among Washington, really nationwide. I think what's staggering is if you think about 111 million Americans are in areas of shortage for mental health providers, which is exactly 1/3 of Americans of the 333 million of us. Those numbers are actually not improving. When you look at the number of mental health providers for the number of people, every single day that gets more disparate, it gets worse. So the stagnating or even decreasing providers and more people in this country. So you can see the problem is something that we are trying to address all the time and really having a difficult time nationwide. And really staggering is 50 to 90% of those in need do not receive treatment or services. So that's very discouraging. So we're here to change that, at least here in Washington, to make that more accessible to you. And next. Things we're doing at Kaiser Permanente Washington and Kaiser Permanente Northwest are really hiring aggressively our mental health providers internally that are our own staff and providers. We're also contracting with other trusted providers. So for instance, we have access to ginger video visits, and behavioral health coaching, which Rebecca had mentioned earlier in the presentation. Very excited to be offering that for lower acuity and support services, in addition to the mental health providers and video visits that we offer as well. Continuing to think about new offices and places around the state where we can make our presence more known, and we're not expanding hours. And also telephone visits and video visits. We went to a time in March because of necessity to go 100% video visits, which worked really nicely because both of our regions already had the infrastructure and we're doing video visits effectively for mental health and wellness in both regions. And then thinking about how we integrate into primary care. So every single time you talk to a primary care or specialty care, even urgent care, we do a screening for mental health and wellness. And if there's a need, our mental health social workers are right there on site and they're able to provide us services and assistance. And that does happen virtually, so you do not have to come into our medical centers for that to happen. The medical MSWs are available online and virtually as well, so that's a great thing that we're doing. In other places like specialties such as maternity care too, we're expanding access to these services. And next. So we really do need to improve member awareness. Some of the things we are doing is making sure that our members know what coverage includes, that there is no referral in either region. You can just simply call a phone number and get access to mental health care. And they will do a complete assessment by a mental health social worker, master's level, to make sure that you're getting the most immediate and appropriate care possible. So all of the emergency care, of course, should go to an emergency room, but those urgent situations, we are actually meeting that 2-day turnaround for all urgent care needs to be seen by a provider within our own system at that time. And then the other choices are available for non-urgent needs as well. And you can choose your own clinician, change whenever you want to, and do know that treatment does work. So you heard some of the things we're doing to increase awareness, lots of campaigns, communication campaigns that we're increasing. We're sending out member emails for a number of times during the month to make sure that they're aware of new services like My Strength and Calm, which were mentioned earlier. And then improving coordination with EAPs, like you just heard Carrie do a wonderful presentation, making sure we're connected and coordinated, that they know what we have to offer so that if referral services are needed, that they can do that very quickly and also know what we can do back and forth. And the next. We have a website at Kaiser Permanente. This is for across the nation for all of our regions, kp.org mental health. And I'm putting this out there for everybody because this is a public website. This is not just for Kaiser Permanente members. We really want you to check out to understand things like what mental health is, how to connect with care, what to expect, how to talk about things among your colleagues and friends and family members. Are you depressed or a drinking problem? Really things that are thoughtful and gives you more information about, you know, if you can imagine in the middle of the night, you might have a family member or a friend, which actually happened to me once, where a friend in the middle of the night called up and just said, you know, I just wanted to say goodbye. And wow, you know, they were thinking they'd gone to this point, and how do you respond, and what do you do? What do you know about the next step that they should take, and how do you talk to them in the moment to make sure that nothing else happens and that they get the care they need? Those are the types of things we're thinking about and making sure that our members and everybody is aware of mental health in general. Next slide. So at Kaiser Permanente, there are many, many ways to access care. They're not even all listed here. We do have a health assessment that does refer people into the triage number when they take the depression assessment for our health profile. But generally, for both regions, the self-referral does not require pre-authorization. You can see the mental health advice number there. That is a different number for KP Northwest, and we'll provide that to you at the end here. Primary care, specialty care, urgent care, I'll refer into this. Employee assistance programs, as we mentioned, they can refer into it, and then the emergency department, of course. The 24/7 care advice by phone, our consulting nurses, how it's more broadly known for both regions, is available too, and they do triage into the most appropriate care, including what's available here. Next. Okay, and then, sorry about that. Some of the resources, convenient resources for members. Now, I did want to mention earlier, we talked about MyStrength and Calm. Calm is available right now in KP Northwest, so in Southwest Washington, their region. It's already up and available for you to download the app and start using it immediately. For Washington members, we will have that available beginning in October, just coming a little bit later because we were on a different platform that we are uploading right now, so that's coming. But for both regions, we do have the MyStrength app, which I would really encourage everybody to look into that. It is a cognitive behavioral therapy app, which has 14 different modules, including things like sleep, which I'm taking right now, which I find to be very effective. And every morning I would do my sleep journal and my little log about how I slept the night before, what things I can do to improve that, really some great tips about how things can be better, and I can be as involved or not as I want to be and really interactive with the site. So those are some great resources, and including the one website you see on the right-hand side, I just talked about kp.org mental health. We also have a stigma reducing campaign that's been in place for a few years now, and constantly changing website called findyourwords.org, and that is a public website as well. Really great information about how to talk about stigma, about mental health, and reduce that, and making sure that you're comfortable with it. How do you really think about this and talk about this in appropriate ways? We also have on our websites mindfulness apps and other cognitive behavioral therapy apps and information that the providers use, including the Thrive app that they can provide to our members through the visits. Additional online support and classes and health classes. We have web wellness coaching for stress or sleep in both regions, and several articles. So again, lots and lots of resources that are available on the KP website. So make sure that if you are a member to go there. And if you're not, these public websites are also very, very useful for you. Next. So KP Northwest, this is their really nice, we call this the peacock wheel, of course, you can see why, the colorful, from all of the different ways that you can access care. There's so many different things. I talked about some of them, but here you can find the phone numbers and websites specifically to go to for this region. The emergency care, specialty care, integration with primary care, and all of the self-care resources we mentioned, including Calm, MyStrength, and the mindfulness app, and the other resources that are on the website. And the next one. Okay, so for Washington specifically, when you get the deck, here are the 3 most important numbers you can know for the one access point for all mental health provider visits. Simply call the 888 number on top. Consulting nurses 24/7, you can see that in the middle because the top number is 8 to 5, so for 24-hour service. Our consulting nurses, which has a physician on site 24/7, is really able to triage any need that you might have. And of course, for general support, our wellness coaching by phone, the number is listed here. And the next slide is the same information for Kaiser Permanente Northwest region in Southwest Washington. So you can see at KP Northwest, the next one. Hopefully it'll advance here. Thank you. So again, their phone numbers are different, but really the information is the same. The one phone number, the consulting nurse advice line, and the wellness coaching by phone. And then the last slide I have, I believe, is really increasing workforce health and resilience. We are here to help you. Kaiser Permanente is here. My colleague Amber Robson in KP Northwest is the same as I do for Washington members that are not in Southwest Washington. We really think about how to integrate support into your workforce health strategies at the agencies and school districts you might belong to. Train employees to be resilient and manage stress effectively. Kaiser Permanente is a champion of school resilience programs, and we do lots of those throughout the year, so make sure you keep open eyes for those coming this fall. And then we organize mental health first aid training. I know somebody had mentioned training for managers. This is excellent. We are getting this revamped. It was mostly on site, and this will be going virtual completely by the 4th quarter. October is what they're targeting right now, so please keep in touch regarding that. And then supporting a really safe, psychologically safe workplace through training and consultations is what we would do for you. And as Carrie mentioned, your EAP will manage on-site clinical interventions and follow-up as well. So thank you. I'm not sure if I have time for one or two questions, but if not, I really appreciate your time.
Yes, certainly. If there's questions, please proceed.
I only have two questions, one for you, Pam, and one for the previous presentation, so Carrie's.
Great.
Okay. All right. Well, why don't we hold those? I'm going to be finishing the content now, and then we're opening it up for final questions and comments, so we'll take those then. Okay, so to segue from Kevin's very informative presentation on Kaiser behavioral health and mental health resources, I want to touch on and give a brief overview and what's provided through Uniform Medical Plan behavioral health resources, as well as Premera Blue Cross resources. So, Uniform Medical Plan offers behavioral health specialists, and these specialists are available to help folks understand and navigate their benefits and care options, help understand a new mental health diagnosis and how to manage the condition, and just overall help identify their needs related to mental health as well as substance misuse. And then there's Doc on Demand, and this is a telehealth services that Uniform Medical Plan offers. And Doctor on Demand provides physicians, licensed counselors, and psychiatrists, and they're available anytime by video chat or computer or app. And that is offered 24 hours a day, 7 days a week, and 365 days a year. Then there's Quartet, and this is a technology and services company designed to support primary care physicians and other and specialty physicians in identifying patients with mental health conditions and helping match them to the mental health providers based on where they live, their insurance coverage, and care needs. And then there's My Strength. They offer that, and that has been mentioned. Kevin addressed that, but again, it's an online app-based behavioral health solution for teaching lifelong resiliency skills. And then they also offer currently, and I believe it is through the end of the year, COVID-19 modules. They're free for UMP members. It includes 15 modules on topics such as coping skills, managing time at home with kids, and a module on links and resources for tools to help you manage the COVID-19 outbreak. All right, so we'll go forward here with the next one. On to Premera Blue Cross resources. Premera Blue Cross offers various levels of care, and these various levels of care are for mental health conditions, substance misuse, and eating disorders that require focused treatment. The plan, based on the plan that you have, it might cover inpatient treatment, residential treatment center care, partial hospitalization, intensive outpatient, and overall outpatient services and care. And the type of providers they have available are psychiatrists, psychologists, licensed clinical mental health counselors, licensed clinical social workers, and licensed marriage and family counselors. There's a link there on the slide and to reference what they offer, and some of that involves numerous links to many resources such as the National Suicide Prevention Lifeline, Lifeline Connections, and Doctor on Demand. So does anyone have questions that I could address for Uniform Medical Plan and Premier Blue Cross resources?
Okay, looks like the questions we have are more overarching than that, Pam. Can we do those now?
Right. Well, thank you.
Okay, sure. We've got two questions about, will these sessions help to earn any continuing education credits?
If this particular training will be available for continuing education credits.
Or if it qualifies for.
No. Oh, qualifies. I do not know the answer to that. I can certainly inquire about that. We have not, checked into that as far as the trainings that we offer, but I think that's a very good suggestion, and I think it's worth exploring. So I appreciate that.
Okay. Then let's see. So we have a question about the EAP presentation from Carrie. This individual wants to sign up for the mental health first aid, but is not able to find it in LMS.
Okay. Let's see. On the presentation, let's see. That's a good question. If you want to give Kat, put in the chat box your email address, and then I can research that and get you the answer. So it might be that I will find out who is the right person for you to talk to, and I can't remember who the individual is who you would talk to about the learning management system in this moment, but I can certainly send that out, or actually I can just send that information to Pam and you can include it if that's easier.
Yes, that would be fine.
Okay.
Because for those questions that we are inquiring about, we will be to work towards getting those answers and solutions and send those out to everyone by email. Okay,
cool.
So I spent the last few minutes. I can advance the slide here. Okay, there it is. I want to mention, there's so many resources that were offered today, and I surely wanted to address a very important resource that we offer that's available for employees and eligible family members, and that's the Smart Health virtual platform and mobile app friendly platform. And we have, Smart Health, within the interest of all the stress and uncertainty and change that's been facing everyone at this time, the Washington Wellness team has been working closely with our Smart Health team to provide online support tiles, activity tiles on the Smart Health platform that can provide support and emotional well-being at this time. So I wanted to highlight some examples of that. So this slide shows some examples of the various mental health support related Smart Health activity tiles. As you can see, help for managing stress and anxiety, and under that, mental health tips, exhale your worries, a parent's guide to dealing with COVID, spend less / stress, and a beginner's guide to mindfulness. A couple other things worth mentioning, there is also an activity on Smart Health for the Washington Listens number, and the Washington Listens is a toll-free line that provides support to people experiencing elevated stress due to COVID, and it was mentioned earlier. Just know that there is a Smart Health activity tile that one can find out about Washington Listen, what it has to offer, utilize it if you feel needed, and you will receive points towards your incentive your wellness incentive. And then also there's an introduction to EAP, Smart Health Activity tile that explains EAP resources and offers links to EAP websites and live and archived webinars that also has points that you can earn towards your incentive. And then lastly, just bringing together the numerous resources that were addressed and talked about today and that we drew from to bring together this presentation. And for example, the first one, and that's indeed where you can find the ICU video and all of the other toolkit and resources for ICU program campaign, and that's at the Center for Workplace Mental Health. We've provided links here. And we will, again, be sending out an email that provides the PowerPoint presentation as well as all the related resources. And again, this has been recorded today, and hopefully we can have the recorded version on our website. We're hoping to get all those things together and ready to send out to you hopefully in the next few days. So with that, just any last questions or comments? Well, we're over by a minute.
Like we have a link in the chat for the mental health first aid training. So if you open up the question box, I just sent that out to all of you in the answer to that question, so you can find it there.
Great, thanks, Kat. And I just want to add, when individuals receive the PowerPoint presentation, that information is included on the link that was included for the particular class, Mental Health First Aid. You'll just be able to click on it and it'll give you all the information there too. So just so you know.
Fantastic.
Thank you, Carrie and Kat. Appreciate it. All right. Well, with that, we're a couple minutes over, so I will bring this to a close, and I want to thank each and every one of you for joining us this morning. And we sincerely hope that you will leave the session today and feel that you've increased your understanding and information around mental health and creating a stigma-free culture, and that you leave understanding the resources that are available and feel that you have resources and toolkits, et cetera, to draw from to address mental health and mental health stigma in the workplace. So thank you all. Thank you so very much to our panel of guest speakers, Rebecca, Carrie, and Kevin. An outstanding job sharing all of what they do in their area of expertise. It's greatly appreciated. So enjoy the rest of your day.
All right, Pam, we got a bunch of thank yous for you in the chat. So with that, we got it.
Well, that's wonderful. We'll take them. Thank you.